Yeah,
Hello, my name is Dr. Gaurav Luthra and I'm a Lasik and cataract surgeon practicing since last 20 years, and we have been doing Lasik surgery for removing glasses since 2002 at my center, and I have had a fair amount of experience in Lasik surgery. So Lasik surgery has become one of the most commonly performed surgeries. It's the most commonly performed elective surgery on the human body anywhere in the world. So it is done in huge numbers, and almost 30 to 40 million people in the world have had some kind of laser surgery to remove glasses. And now many people come to us asking that if LASIK surgery is safe and who should do it, who should not be doing it, and what are the various procedures available. So I thought I would discuss all the options of doing a laser surgery with you, and I would like to start with the fact that LASIK surgery started somewhere in the 90s, early 90s, and it first started in Greece. Professor Palikaris was the first one to do a LASIK procedure. The excimer laser, which is used to do the LASIK procedure, was invented by an Indian, Srinivasan, and that's how this surgery first started on the eye. In India, LASIK came somewhere about 1995, and first started somewhere in Chennai or in Delhi was the first machine. And ever since, it has become a very, very popular procedure even in India. We started doing it in 2002. So essentially, there are various procedures which are possible. There is a procedure called PRK or surface ablation. That's how LASIK started first, followed by the actual LASIK procedure, because PRK used to be painful. It used to take time to heal. So it was followed by the development of this new procedure called LASIK somewhere in 1995-96. And that became really popular, and then after that we've had newer and newer procedures like customized LASIK, wavefront LASIK, topo-guided LASIK. So there are a lot of refinements on the LASIK procedure as well, which came over the years. And of late, last few years, we've been doing a newer form of LASIK called Contoura LASIK, which is a very advanced form of LASIK and has become very popular. And then we also then added another newer procedure called SMILE, which is an even more advanced procedure than LASIK in some ways, and has been become very popular as well. And we are lucky to be performing all these procedures at our clinic here, and also in the country there are a lot of centers which are doing excellent work with all these procedures. Now, who is eligible for LASIK? So anybody who's over 18 is technically available for LASIK, but we typically would discourage the 18-year-olds from getting a LASIK surgery. We typically try to tell them to wait until 19 or 20 or 21 till you've achieved maturity and your powers have stabilized. So if you're looking for LASIK, the most important thing is to go for a LASIK evaluation. Go to a good LASIK surgeon who can do some tests on your eyes and guide you whether this procedure is suitable for you, whether the time is right, and which kind of procedure to choose. And you should also be educated yourself. You should read up on the internet. There are very useful resources. There is the American Academy website. There are so many other reliable US FDA sites which give a lot of fair data about which are the procedures and which ones are thought to be safe and good, and currently which are the best accepted procedures. Of course, there is a lot of advertising, and you could hear about Q LASIK and customized LASIK and Contoura LASIK, and there are so many names given to various procedures, but essentially they are all some refinements of the LASIK procedure. So once your power has stabilized and you are eligible for LASIK, you can think about it. Now, different procedures are used for different situations. For example, PRK or surface ablation, which initially started off as the first one, is still very popular now in a newer form, and we do something known as advanced surface ablation, which is still a very, very good procedure. And we typically use this for smaller powers like 3 to 4 or 5 diopters, and it is considered as a very, very safe procedure. LASIK can be done up till say minus 10 or 11 or 12 depending on your corneal thickness. It works really well for astigmatism or cylindrical powers, and you can correct cylindrical powers right up till minus 5 or 6. Plus, LASIK works extremely well for plus numbers as well, and you can actually treat powers of plus numbers up till plus 5 or 6 at the most. So what is SMILE? And SMILE is a further advancement on the LASIK procedure. The difference is that in LASIK we typically make a thin flap of tissue which is removed from the cornea or the black part of the eye, and this layer is of about say 100 to 120 microns, 1/5 the thickness of the cornea. So as we've been doing LASIK for 20 years, the only one small fear in our mind used to be that LASIK may potentially create a flap complication. It's not common, it's extremely rare, but once in a while if you get hit in the eye even 10 years after surgery, you could end up with a flap complication. So SMILE tries to rectify this thing by not needing to make a flap, and it is a flapless kind of LASIK procedure done using a special femtosecond laser. So SMILE has a limitation. It cannot be used for plus numbers, it cannot be used for very high cylindrical numbers, and it cannot be used for powers beyond -10. So SMILE works very well for minus numbers from -1 or 1.5 till -10. And yes, the SMILE patients recover a little faster as far as their precautions are concerned compared to LASIK. But certain forms of LASIK can be very good, even better than SMILE for vision correction. So for people with high astigmatism or patients with plus numbers, a form of LASIK called Contoura LASIK has become very popular, and that can be thought to correct your vision in a much better way than any other form of available treatments. So at our center and at many other good centers, we choose Contoura LASIK for patients with astigmatism or cylindrical numbers and with plus numbers or hypermetropia. And we tend to choose SMILE for those patients who have minus numbers up till -10 or 12. So a good way to decide whether you are eligible for LASIK is to go to a good LASIK surgeon, get an evaluation, maintain records of all your powers, and ensure that you have a stable power over the last couple of years, and then you can think about it. Educate yourself by visiting doctors, by reading on the net, and once you're convinced that this surgery is for you, you can easily go for one of these surgeries. They are very safe. And with that, I think I would like to finish here. Okay.